Hey guys, Tony Maritato here, licensed physical therapist, and in this video I want to talk a little bit about the language of pain. So we all have our different words, we have our different descriptors. I can tell you that as a physical therapist, being in the clinic over 21 years, I've heard a lot of similar descriptions for pain. I've heard a lot of the same adjectives and verbs. I've heard a lot of similar stories, enough to say that I finally feel like I have a grasp on certain conditions. But I wanted to spend some time in this video helping you understand what's going on inside the mind of the therapist when you're talking to them about your painful condition, specifically shoulder, since this is a shoulder YouTube channel. But I, as a physical therapist, when I'm initially evaluating a person who comes in with shoulder pain, let's say that this individual has not had surgery and this person has been dealing with pain for anywhere over 3 months. There was no traumatic injury that happened that caused the pain. Maybe they were trying to remember back, well, I think I did this, or maybe I did that, but it wasn't like I fell off a ladder, landed on my shoulder, or I got hit by a car. It was my shoulder started to hurt. I tried to find a reason for it, and it's just progressively gotten worse, or it's not getting better. So as a therapist, what I'm trying to determine is, do I believe there's a mechanical problem that's going on? Do I believe that there's a specific structure involved? And so when we're talking about the shoulder, and really almost any part of the body, there's only a handful of structures that could be involved. So I want to determine, do I think it's bone? Do I think it's the cartilage that's covering the ends of the bone, creating the joint? Do I think it's, and I'm going to generically say connective tissue, but do I think it's tendon? Do I think it's ligament? Tendon connects muscle to bone, ligament connects bone to bone. Do I think it's something that's sensory, something that's involving the skin or sensations from the nerves? Do I think it's a neurologic condition? Do I think it's related to the vascular system? Sometimes there can be problems in the vascular system that's generating information that the brain is perceiving as pain. And so as I'm going through my list, I'm testing and checking and asking questions, and I'm really probing deeply into not just what my patient is saying, but how they're saying it, looking for the answer behind the scenes, right? Because I've spent 21 years in the clinic. I had years and years, going through school and anatomy and continuing education, and I've been fortunate in that I've seen thousands of patients over this time, whereas you only have the experience that you have within your body. And while your experience of what you're feeling in your body is unique to you and only you can really understand it, I'm trying to make sense of it from outside your body, because I don't know what you feel. I don't know how you perceive what you feel. So that's where we get into asking questions. So a patient might come in and say, my shoulder hurts. And I want to first localize, is it the shoulder? Is it the structures of the shoulder? To me, the shoulder is a very specific anatomical piece of your body. But for my mom, when she developed frozen shoulder and shoulder pain, she was referring to pain down in this area, about mid-humerus. As a clinician, that's not the shoulder, that's the mid-humerus. But to my mom, anything above the elbow and below the earlobe would be the shoulder. So we want to determine, is it neck? Is it shoulder, actual shoulder glenohumeral joint? We want to determine what the structures are. So if I think it might be muscular, I'm going to do tests and ask questions related to muscle function. If somebody comes in who can actively move the hand, flex the elbow, extend the elbow against resistance, but they can't do things overhead, it would indicate to me that certain muscles are fully functional. I want to do things that would put certain tissues on stress. So there are things that your therapist would do to test the cartilage, separately from testing the muscle, separately from testing the tendon, separately from testing the ligament, whether it be active movement or them asking you about certain activities that you might be doing at home or around the house. And then we want to understand the way you describe pain. Is it a burning pain? Is it a sharp piercing pain? Is it a dull ache? Is it a throb? Do you feel a pulsing sensation? Does your pain change with activity? Some patients come in and they feel the same constant level of pain, throbbing, aching, soreness, whether they're doing stuff or whether they're not. One of the common questions I like to ask related to pain is, when you first wake up in the morning and you start doing those first couple of things, maybe you're brushing your teeth, you're going to the bathroom, you're washing your face, what does the shoulder feel like during those activities compared to maybe 2 hours later? You've already had breakfast, you've already started your day, you've gotten into your work or your workouts or whatever it is you're doing in that kind of late morning time. Do the symptoms change? Does the pain, the stiffness, the soreness go away? Is what you're feeling in the morning truly pain, or is it stiffness? Does it feel like it's coming from the muscle or the joint? And then, does it change again later in the day? Do you feel a different kind of pain into the evening, after sunset, after dinner, after you've wound down? You're getting ready for bed, you know, everything is calm. Maybe you read, maybe you watch TV or whatever you're doing. Are the symptoms you're feeling at that point the same as the symptoms you felt first thing in the morning as you got out of bed? That's important information, and that's information your therapist needs to know, because that can also help us understand the cycle of inflammation. Do we think that it is an actively inflamed tissue that's got histamine and other immune responses going on? Or do we think it's more of a tendinopathy, tendinosis, damage to the tissue, but maybe not active inflammation going on at the moment? At the end of the day, any therapist that's going to work with you is really functioning as an investigator. The actual treatment, the actual interventions, the exercises they prescribed, all of those things are dependent on your therapist fully understanding what it is that you're experiencing and quantifying what your pain experience is and how we can classify that. Because the better we understand, sometimes it has nothing to do with the tissue at all. We had a case recently where the patient was experiencing symptoms coming from the neck. The shoulder was the original diagnosis, but upon further investigation, I was able to reproduce, diminish and increase symptoms in the shoulder based on what I was doing to the cervical spine. So we realized that no, this is actually more of a cervical spine nerve root issue that's manifesting as discomfort, weakness, functional limitations in the shoulder. So my point in this video is really to say the questions that are being asked are intentional, they're purposeful, they have meaning behind them, and the better that you can understand how to describe the symptoms you're feeling and what your therapist is trying to figure out will better help your therapist develop an appropriate treatment program for you to get you out of the pain that you're experiencing, back to doing the things that you love to do most. If you have questions, if you have experiences, if you have great stories about amazing therapists or frustrating stories about less amazing therapists, share them down in the comments so other people can know what to expect when they get referred to physical therapy for a painful shoulder condition. In the meantime, guys, thank you so much, and I'll catch you on the next video.